Welcome to the Primetime Health Channel. Cholesterol can be reduced without medication. Many patients who come to the doctor with high cholesterol say they don't want to take statins because these drugs have several contraindications. In this video, I will give you a few tips on how to lower cholesterol without pills. 25% of cholesterol comes from food, but only from animal-based foods. Plant-based products do not contain cholesterol, and 75% of cholesterol is produced by the body's own tissues, mainly the liver. It is a component of hormones, vitamins, cell walls, and bile acids. The liver has an enzyme responsible for cholesterol synthesis. This enzyme is most active at night and is activated by insulin. If we eat at night or in the evening, we provoke insulin production, which activates this enzyme that affects cholesterol synthesis. And of course, cholesterol starts to be synthesized in the liver at night. There are different types of cholesterol: high-density lipoproteins, HDL, low-density lipoproteins, LDL, and very low-density lipoproteins, VLDL. The liver synthesizes only low-density lipoproteins. But if we don't eat at night, practice intermittent fasting, and experience hunger during the night, an intracellular enzyme called AMPK is activated, which in turn blocks the activity of the enzyme responsible for cholesterol synthesis in the liver, thus preventing cholesterol synthesis at night, in the volume that it might otherwise be synthesized if we eat at night. From this, we understand that the key factor in cholesterol synthesis isn't whether we eat vegetables, fruits, or meat, but when and how much we eat. When cholesterol levels rise and we eliminate all fats and fatty foods from our diet, this only normalizes 20 to 25% of cholesterol. Second point, cholesterol is synthesized in the liver and then needs to enter the bloodstream. Since the liver produces only low-density lipoproteins, LDL particles are released. These have a protein fraction, like a lock, called apolipoprotein B. This apolipoprotein B acts like a lock, searching for cells. Cells have receptors for apolipoprotein B. Cells that need cholesterol interact through apolipoprotein B with cholesterol and low-density lipoproteins. The cell takes the cholesterol it needs, and the remaining cholesterol is sent back via high-density lipoproteins, HDL. High-density lipoproteins also have a similar protein lock on top, called apolipoprotein A. Apolipoprotein A goes to the liver, where there are receptors for apolipoprotein A. And in the liver, they are used for the synthesis of bile acids. In the lumen of the small intestine, they are reabsorbed and again enter the bloodstream, and through the blood, back to the liver. This is how cholesterol constantly circulates in our body. This is called the enterohepatic circulation of cholesterol in the human body. In people with hereditary hypercholesterolemia, cholesterol enters the bloodstream and cannot find a cell. It circulates and accumulates there. That's why their tests show elevated levels of low-density lipoproteins. Why does everyone strive to lower cholesterol? Because cholesterol, especially low-density lipoproteins, is the main factor in atherosclerotic changes in blood vessels, i.e., plaque formation. So, how to reduce cholesterol levels in the blood? First, of course, consider your diet. Reduce consumption of cholesterol-containing foods, meaning animal-based foods, specifically animal fats and proteins: pork, veal, lamb, chicken, and game. Second, create a negative energy balance. That means eating less than we expend. And as you've already understood, don't eat at night. Thirdly, fiber consumption. Fiber refers to rough plant fibers, which can be fermentable or non-fermentable. Fermentable fiber is the type that serves as food for our gut bacteria and is fermented by bacterial enzymes. In our case, to lower cholesterol, non-fermentable fiber is more suitable. What's important for us is soluble non-fermentable fiber to reduce cholesterol. One example is psyllium. Psyllium works for everyone because it is non-fermentable and soluble, so it doesn't cause gas. However, fermentable fiber can also be consumed, but it doesn't suit everyone since it may cause bloating in some people. How does fiber help lower cholesterol? As I mentioned earlier, there is enterohepatic circulation. Cholesterol exits the body with bile into the intestinal lumen and is reabsorbed in the small intestine. When it is in the small intestine, soluble fiber swells and absorbs bile acids along with cholesterol, helping to eliminate them from the body. If this happens consistently, the liver has to increase its receptors to pull more cholesterol from the blood. This reduces low-density lipoproteins, LDL, in the blood. Next, abdominal massage stimulates blood circulation in the organs of the abdominal cavity, including the digestive system organs. This includes the liver. In turn, this slows down the synthesis of low-density lipoproteins in the liver. The use of omega-3 fats in foods containing omega-3 helps lower cholesterol. It's believed that omega-3 can reduce cholesterol by 20 to 30%. Foods rich in omega-3 include seafood, fish, fatty varieties, and so on. It's important to emphasize that if you're using omega-3, it starts working only after 3 or more months of consistent intake. Omega-3 helps reduce the synthesis of low-density lipoproteins in the liver, as omega-3 affects the activity of the enzyme responsible for cholesterol synthesis. As you've already understood, it's crucial to monitor your blood cholesterol levels and keep cholesterol within normal limits. This is very important for our blood vessels, meaning it's vital for our heart, brain, and all organs. Our body is an interconnected system. It doesn't function based on just one factor or rule. We need to approach our health holistically. As they say, doctors treat diseases, but health is each person's personal responsibility. Of course, as I mentioned earlier, creating a negative energy balance is essential. By this, I mean increasing physical activity, exercising more, eating less, and always keeping track of how many calories you consume versus how many you burn. You can follow all the rules I've outlined here, but if you ignore the most important one, eating more than you move, nothing will work. You might get frustrated thinking nothing is working, but the truth is, you're not following the most critical principle. And the most important principles depend on us, our efforts, and our intentions. Please comment below. Do you monitor your cholesterol levels? And what are you doing to lower them? Thank you. Stay healthy.